Welcome, everyone. Welcome to the Social Work in Libraries Online Simulation Hub Public Lecture Series. Before we start, I would like to acknowledge, as members of the CSU community, we acknowledge the words of the Wiradjuri people on whose land our university was founded and shared their aspiration of Yindamara Benangana, the aim for us all to learn the wisdom of respectfully living well in a land worth living in. We pay our respect to the traditional custodians of these lands where we live and work, and extend that respect to any First Nations peoples present here today. So before we start with the public lecture for today with Dr. Mary Provence, I would like to introduce you to the project, the Social Work in Library Online Simulation Hub Facilitating Industry Engagement Project aims to promote partnership with public libraries by bringing social work to communities at the grassroots level, promoting co-design research and enhancing andragogy for social work and information studies students. It's been funded through the Australian government's national priorities and industry link funds. As a part of this project, we will be hosting a public lecture series across the next 2 months on various Thursday mornings and lunchtimes. So for today, we have Dr. Mary Provence with us, and I would like to thank our second speaker, who is Dr. Mary Provence. Mary Provence is an assistant teaching professor of social work at Ball State University and is licensed clinical social worker with both her Bachelor of Social Work and Master of Social Work. Mary has been a social worker for 31 years at both the micro and macro level. Much of her social work practice has been in community development in her urban Indianapolis neighborhood, where she was loved, lived, and learned for over 27 years. In her early career, she spent 4 years as an outreach social worker on the streets of Indianapolis with youth experiencing homelessness. That experience, combined with her desire for social justice and her love of libraries, fuels her passion for library social work. Mary is an avid researcher of the emerging field of public library social work as a response to homelessness. Over to you, Mary. And I'm going to stop sharing my screen.
Okay. And I just realized I left my computer glass attachment in the other room, and I'm going to get that so that I can read better on the screen. Give me just 1 second. I apologize.
And I just noted in the chat, if you have questions during the session, please feel free to pop them into the Q&A, which should be accessed on your Zoom toolbar, and then we'll get to those at the end of the session.
Okay, let's see. I am not seeing my share function anymore, or any controls at all.
Maybe not on the bottom of your screen, Mary, or?
No, they were there earlier when we practiced, and now they're not. Okay, there we go. All right, thank you for your patience, everybody. So it's good to see everybody this evening. Thanks for coming and your interest in my research. My name is Mary Provence, and the title of my lecture tonight is Library Social Work Practice Models and Implications for Structuring Your Library Social Work Program. Now, this study was conducted entirely while I was at Indiana University School of Social Work, and you can see the protocol number there. Currently, I am a professor, assistant teaching professor at Ball State in Muncie, Indiana. A little background on the study. So this is a part of a much larger study, and that study built on a pilot study that I published back in 2020. And then this study that I'm presenting tonight was just published in the Journal of the Australian Library and Information Association, and I was so pleased to work with Charles Sturt University to make that happen. And it's an update to the lecture that I provided to their online social work and library symposium last December. So there are some similarities, but because that was a preliminary analysis, I've now completed the analysis, so it'll be a richer, fuller discussion tonight. So there's 3 objectives tonight. The first is to identify and describe 3 different models of library social work practice that are operating here in the US in urban libraries. Secondly, we'll explain and compare how each model impacts the de-escalation role of the social worker in crisis situations, specifically with patrons experiencing homelessness. And finally, we'll discuss implications for structuring and integrating social work practice into public libraries. Now, the need for this study comes because, as we've talked about library social work models in the last, decade or so since social work has emerged in libraries, we've traditionally been talking about them in terms of the status of the social worker, if they're full-time, if they're part-time, an intern or volunteer, and who their employer is, and if there's any collaborations, because oftentimes social workers might be employed by an outside agency and maybe granted to the library for a certain number of hours a week. There might be other collaborations at play. Sometimes the social worker might even be hired by the city or the municipality. And so a lot of times when we've talked about these models in the literature, those are the models that we're talking about, because social work is starting to gain speed, and people want to know, well, how do we do that? How do we fund it? How do we get those roles in the library? And so I think that's why these models have taken the dominance in the literature so far. However, we're starting to see some practice stuff start to emerge. Just recently, Finch and Reel did a really nice study where they interviewed, I believe, 5 different social workers in different libraries, and they observed that all the social workers were using what they called a resource and referral model. And they also described social workers using a tabling practice where they would set a table up somewhere in the library and initiate contact with patrons. Mark Geisler, who's done a lot of study on library social work so far, he compared some of the ways that social workers were acting in libraries to the street outreach model that's associated with street outreach teams to people who are experiencing homelessness in the community. And then Hill and Tanneman talked about an open window hub, and that was where the social worker would sit again at kind of a window style place, and patrons experiencing homelessness could walk up and directly ask for help. And then finally, Jane Garner from Australia talked about how their social worker at their inaugural library that started social work there in libraries, that they initiated many of the contacts. So that tells me that they were probably doing some form of outreach as well. So in terms of the gap, while de-escalation is talked about in the literature in terms of that library social workers are doing it and that they are training in it, there really hasn't been in-depth study on, well, how are they doing it and what kind of impact is it having? And then secondly, we don't have any models so far that have integrated this de-escalation role with where the social worker is positioned in the library and how they're accessed. So tonight, I hope to do that. So briefly, I want to tell you about my methods. Now, keep in mind, this was a much larger study, so I'm going to briefly highlight how the overall study was designed. So I used an explanatory embedded multiple case study design, primarily using Robert Yen's method as a guide. I was able to collect both qualitative and quantitative data because case study is flexible like that. And then I had 3 urban central library locations that served as cases. Now, the overarching question of the larger study was, how are social workers changing how libraries respond to patrons experiencing homelessness when they're in crisis? And at each of the libraries, I had 6 subunits of analysis, and you can see those 6 different roles listed on the screen. And then I had 2 sources of data. I had the Zoom interviews and then the Qualtrics surveys. So for the first 3 roles, the social workers, the front-facing library staff, and the police or the security, I surveyed them and did Zoom interviews. And then for patrons experiencing homelessness, the location managers and the chief executive officers, I just did interviews. Now, data collection took about 3 different months. I spent about an average of 48 days per site doing the data collection via all electronically, through Zoom and through Qualtrics. The managers were great and helped push out those surveys via email. And then I also helped with the social work surveys. And then the interviews were recorded, and I had 5 different semi-structured interview guides. And I also want to say that all the surveys were distinct by role too. So I had quite a few different instruments operating, and while there were similarities in them, they were specialized according to role. In terms of getting libraries to participate, I did a criterion sampling process where I started with the list of library social workers listed on the whole person librarianship website, which I'm sure many of you have seen. And I narrowed that down of criteria to libraries that had full-time degreed social workers that were open in the time of COVID and that were located in a city of 100,000 or more. And I attempted to get libraries in different regions of the country that included an emphasis on racial minorities within the library social workers. So the CEO at my hometown library agreed to keep confidentiality of the 6 libraries that I selected. And he sent letters of introduction. And my goal was to get 3 of them to participate. And that was the result. I had 4 that were interested. 1 I had to screen out because they didn't actually have a degreed social worker. So I ended up with the 3 that I wanted, which I was super happy about. So as the interviews progressed, it became very evident that each of the 3 libraries was operating on a very different model of social work practice. And so I began kind of sketching and drawing because I was trying to make sense of what I was hearing. And so this is a very early pencil drawing of the social work models that I'm going to be presenting tonight. And so what I did, I stayed really close to the data, and I kept revisiting the answers to the questions in the case study protocol. And I kept revisiting and making sure that I was really figuring out how social workers were accessed, where they were positioned, who, how were they functioning within the library. And so I also would then check back in with the social workers when I had clarifying questions that I needed to do. And from that, the models that I'll be sharing with you tonight emerged, and I was able to put them in a table form and give them names. So I'm really excited to share that with you here in a moment. So let's move to the findings. In total, I did 46 interviews, and those were averaged about 45 to 60 minutes each. I had 91 usable surveys that were collected, and there were a total of 107 unique participants. At case 1, there were 22 participants, 38 at case 2. At case 1 were 22, 2 was 38, and case 3 was 47. Here are the participant demographics, and I just want to give a few highlights. So participants were primarily women for all roles with the exception of security. And then for participants who shared the race, patrons experiencing homelessness, security roles, and social workers were predominantly Black, while the front-facing staff were mostly white. The mean age of each of the professional roles was in the 40s, and the patrons were slightly older with a mean age of 50. Of the social workers, there were 5 full-time female social workers, 4 were Black, 1 was white, 1 had a BSW, and the other 4 had MSWs. Now, while not initially planned for, all 3 of the libraries had additional persons working alongside or under their full-time social workers. And due to the fact that I used a pragmatic paradigm, I flexed and invited them to participate in the study, and that was really informative. There were several interns that participated, as well as a paraprofessional. Now here we see the front-facing staff characteristics. Each library had different job titles for similar roles. So all librarians, regardless of their assignment, such as a children's librarian or reference desk, were classified as librarians. Checkout staff were collapsed under the title customer service, and library associates and assistants were combined into library assistants. And then at case 1, the front-facing staff were almost all librarians. At case 2, they were almost all library assistants or customer service. And at case 3, we had mostly librarians, managers, or supervisors. Now, corresponding with the higher number of librarians and supervisors at cases 1 and 3, we had a higher number of participants with a master's degree, while only a quarter of the case 2 participants had a master's degree. These folks had also had pretty long longevity in terms of their length of employment. At case 1, the average was almost 10 years. At case 2, it was a little over 6 years. And at case 3, a little over 10 years. And at all cases, most of the front-facing staff were full-time. Now, in the security roles, they had various roles and titles, which we'll talk more about in a moment, but they were primarily employed by the library. Most had some college experience or a college degree as their highest level of education. That was 100% at case 1, case 2, and at case 3, it was 83% had a college degree or some college experience. Now, across cases, 55% of them that were in a security role either had a security guard training or were a police academy graduate. Now, none of the guards or library staff serving in these roles were armed. However, the 2 police officers at case 1 were armed. Each carried a taser and a gun, and one also carried a baton. Most of them had been employed 5 years or less at the library or branch across cases, and most of them were predominantly employed full-time across cases. Now, before we talk about de-escalation, I think it's imperative that we talk about what is a crisis at a U.S. library. So I purposely did not define crisis for the study because I thought it was really important to hear what each role and each participant thought a crisis was. And so to understand what they meant by that, I didn't flat out say, hey, what's a crisis? I just asked them to share examples with me. And so this chart that you see here is specifically to front-facing staff and security only. And they were asked, what are examples of crisis situations you have encountered at your library? And participants were really eager to talk about this. Almost everybody answered this question, and they often answered in great detail. And so I spent a lot of time analyzing their answers phrase by phrase in a reiterative fashion and categorized them. And the numbers that you see here are frequency counts of the number of examples of each crisis given. So for example, where I have 26 under lack of basic necessities at case 2 under the front-facing staff, that means of the front-facing staff, I got 26 different examples of basic needs. So, so the level of severity could be quite broad. Some of it was, the most severe that could cause imminent or immediate danger for others, I themed as violence and threats or endangerment of staff. And the violence and threat examples were very prevalent in the data. And I want to give you how serious they were. At case 1, the examples included violence and, an active shooter, threats, violence, and patron-to-patron fighting. At case 2, the examples included weapons, stabbings, threats, unspecified violence, patrons assaulting patrons, patrons fighting patrons, patrons sexually harassing other patrons, and patrons sexually assaulting other patrons. At case 3, I got examples of an active shooter nearby, a bomb threat, unspecified violence, patron-to-patron assault, and patrons fighting patrons. So as you can see, some very serious types of crises. Now, there are also issues of mental health crises, medical emergencies, substance use issues, and overdose, all posed varying levels of danger from something relatively minor, such as a person experiencing a symptom of a serious mental illness, to actual suicide attempts in the library, or serious medical emergencies requiring immediate medical attention. The library was also a safe space for victims of violence, ranging from theft to rape, where they would come and report and get help. And then there were less severe examples, such as the lack of basic needs, non-compliant, and strong emotions. Now, the strong emotions really caught me by surprise because I, by training, am a social worker. And so as a social worker, I don't typically associate strong emotions with crises, but many of the participants did that were especially front-facing staff and even a few security guards. But what was really notable is when I talked to the social workers in their interviews and they shared examples of crises, none of them saw strong feelings or yelling as crises. And so that seemed to really highlight a difference in training and a difference in roles between the three different professions involved in this study. So I also want to talk about the security model at each case, because this was very important. Each library had a different model of security, and they each interacted with their social work team in different ways. So at case one, there was a team of unarmed security guards assisted by 2 armed off-duty police officers. Now, these were not always the same 2 police officers. And this team was led by a designated library staff member who somewhat jokingly said to me he had been pulled into a dark room about a year prior and told he was the head of security. So he was a library assistant that all of a sudden was supervising not only security guards, but also police officers, which I found fascinating. At case 2, they had persons in charge, or PICs for short, and these were library staff working very specifically in full-time security roles. And they were not only in charge of, crises, but they could also, if the toilet was stopped up, you called the PIC. If there was a crisis or an argument, you called the PIC. And so while there was an unarmed security team in the library, it really became evident as I talked to all the participants, it really seemed like the PICs were kind of the lead arm and took more of a role in that, even more so than the security team. And then case 3 had an unarmed security team who all worked for the library, and some of them were former police officers or military, and they had at least 4 on duty at all times. And this was the library that the head of security was an ex-police officer who had her MBA. She was an African-American female. This team was primarily African-American, and they were described as a highly compassionate and highly skilled team. So in another study that I'm not going to be presenting tonight, there was a very interesting dynamic of the willingness or lack of willingness to call the police that was also at play in the study. So be looking for a new publication coming out in the next few weeks from the same journal as well, that will get into that. Now, here we have the models, and all of the library or social workers agreed that de-escalation was a role task, but how they did that role was a little different at each library. So first, I want to talk about what seemed really important to the model. One was the staffing. So you can see here, in the left-hand column, none of the social workers were working alone. Case 1 had a very large team of BSW interns and then a part-time MSW field instructor. Case 2 was the smallest social work team, and that was a full-time social worker. And then they also had a licensed mental health professional that was also there. She did not choose to participate, but from what I gathered from participants, her role was very similar to the social workers. And then the last case had 3 full-time MSWs, which I thought was amazing. They also had an intern and 2 paraprofessionals. So that was also a very large team. So the first model I called the sign up and summon model. And how that worked is the social work team was positioned near the security desk in kind of a large open area, and they had 4 desks, and patrons would sign up and meet with them. If they were already an established client, then they could sign up for return appointments as well to follow up on issues they were working with the social worker. But what was really unique about this library, now remember, they had armed police officers in the building. They saw their BSW social worker as the expert in de-escalation, and they would summon her to anywhere in the library. The police officers could summon her, the security team could summon her, or the manager could summon her. And so she really had this key role, and she viewed herself as a de-escalator, and she saw that as part of her role. And that was really important. The social worker's perception of their own expertise and their own role really played an influence on these models. And so in her role as de-escalator, she would go throughout the library. She would address the felt needs as defined by the patron. She would leverage the relationships she already had with them. So if she already knew information about them, that could lead her to better outcomes with the de-escalation versus a police officer who might not know anything about that patron. So the social worker would leverage those relationships. And then they had a mobile crisis team in their city. And so when there was a true mental health crisis that needed, intervention beyond the library, the social worker and the police officers would work together to coordinate that response and to get that crisis mobile team to the library. So next, at case 2, we had an outreach and summon model. And in this case, the library social worker had an office, but it was tucked back behind, like in the private staff area. So patrons couldn't actually come to her office. But instead, she would either do outreach in the library. She would walk around and she had little cards that introduced herself and explained what she did. And she called them her ticket to outreach. And she would walk around, introduce herself to people. And if they said, well, yeah, matter of fact, could you help me with this? She would immediately, engage with them right there and attempt to help. However, sometimes people needed time to think about it or process it, and they might come back later that day or, later next week or even a month from now, knowing that she was there, and they could come and ask at any desk in the library or ask any security guard or any PIC, and they would summon her to come. Now, the PICs streamlined the summon process. So what was neat about this was that even though any front-facing library staff had the ability to say, hey, a social worker is needed, they would call the PIC and say, hey, a social worker is needed. And then the PIC would call the social worker. So that way you didn't have, 50 library staff all calling the social worker. You would have the PIC calling the social worker and kind of streamlining that process. They would know if she was with somebody or if there were multiple people in line waiting to see her. So the PICs kind of funneled those people to the social worker. And then they also would summon her to anywhere, not only in the library, but outside the library as well, like the sidewalk in front of the library. And then her de-escalation role was similar to the first in the first few steps. But when we get to the mental health piece, it was very different. This social worker had extensive experience in crisis response. And she was what she called certified to do transport holds. And what that means in the US is that she could require a person to get in an ambulance and have to go to the emergency room for an assessment. And so, and that might involve a police officer to execute that transport hold, but she could write the hold and say, hey, this is what's happening, and this is why this person needs to go get assessed. And so they could pick that person up from the library, take them to the ER, and then the emergency room would decide if they needed to be held for 72 hours. So that was unique to this case. And incidentally, at this case, the social worker was hired specifically to do crisis response. And it was only after she got involved in the library that her role evolved beyond the crisis response portion. Now, at the third library, they called themselves having a social work center. So I named it what they called it, which was a social work center model. And so they too used the sign-up sheet at the social work center, but they had a beautiful facility with multiple offices so that social workers could meet privately with a patron. But they also had an open area within their center that had a computer and a phone where patrons could, sign up and then wait, and then they could make a phone call. They could call their grandma, or they could call the Social Security office, and they could also use the computer right there as well. And this social work center was really amazing. Like I said, they had a highly skilled team of 3 MSWs plus some paraprofessionals and interns. Excuse me. But they had a policy that anyone was welcome to come see them, but they needed to come to the social work center versus them going out. They wanted it to be strictly voluntary. And unlike case 2, where at case 2, a person could see a person in distress and say, hey, even without talking to them, they could see a patron, think that they were in distress. They could call for a PIC and say, hey, there's a patron here that's in distress. I think they might need the social worker. Whereas at case 3, the social workers felt that it was more important for the person to be voluntary. And while, yes, any staff or security could tell the patron about the social work services and even escort them to the social work center if the patron agreed, they did not want anybody forced to come, and neither would they be called out to go meet with a person. There was a couple exceptions, and that was in the case of an unaccompanied child or a child in crisis. They would often get, or not often, but sometimes would get called to come to the children's area, the family and children's area, to meet with an unaccompanied child, or to meet with a family who had agreed for the social worker to meet with them, but maybe it was just easier for them to stay in the children's area, where their children could play while they met with the social worker. Occasionally in a mental health crisis, the security team would ask them to come and consult, but again, they would not approach a patron. They would just kind of give advice to the security team who was working the situation on what they might need to do, but they again would never approach a patron who hadn't asked for their help. So again, I want to emphasize that even though the case 3 social workers didn't see de-escalation as their role outside the social work center, they did see it as their role inside the social work center, and they were highly skilled. They also didn't see mental health as their expertise. However, as I talked with them, it was very evident they were highly skilled at assessing mental health issues. And so they were doing those things within the social work center and doing an excellent job at it. Now let's talk about the implications. So as I talked about, the models varied by their staffing levels, where their social workers were positioned, and how they were accessed. The social workers also each differed in both their experience levels with crisis and intervention and de-escalation, and also their perception of their own role at the library. And all of those things affected the model. Now, all the models did have some similarities to the de-escalation strategies, and those were addressing the felt needs, leveraging the patron relationships, and addressing those mental health crises in some fashion, though that was the area where there was really some differences across the 3 in just how, what resources they had at their disposal to address those mental health crises. Now, the cool thing is that all of these models were perceived to reduce reliance on law enforcement. Now, I want to emphasize that word perceived, because this was a study that was based on the perceptions of all the roles involved, versus, an examination of 911 calls or incident reports, which hopefully someday I'll get to do that study. So the sign up and summon model was reported by the participants to reduce and modify interactions with security and police, to reduce those exclusions out of the library, to reduce arrests, jail, and even taser incidents, because as you remember, the police officers did have tasers. And then the outreach and summon model had the perceived impact of modified interactions with the PIC team, a smaller rise in crisis incidents. Now, let me explain that. This was in a very large city that was escalating with drug use and substance addiction issues, and there were crises just all around everywhere in their community, and so all of that was coming into the library. So it was rising. The rate was actually rising, but they felt like it was rising slower due to the fact that they had the social worker there. They also had a perception that there were fewer calls to the police, fewer acts of violence, fewer arrests, and less people going to jail. And then with the social work center model, they reported that there were fewer interactions with the safety team. And as a result, there was less risk of being excluded from the library. Again, I do want to reiterate, there was another factor going on here with people being reluctant to call police, and that's going to be presented in my next study that's coming out soon. So that was a rival theory that was at play and affected these models somewhat. But we don't really have time to get into that tonight. But if you have questions, feel free to ask at the end of the presentation. So in regards for implications for as you might be planning to integrate social work into your library, or even maybe you already have a social worker and maybe it's not going as you planned and you want to kind of relook at how can we reformulate our model that we're using. So first of all, I think it's important to consider what the goals of your library social work program are and what your patron needs are. And if you haven't already done it, a needs assessment is a really nice place to start. Not only assessing the needs from the perceptions of your staff, but also the needs as perceived by your patrons. And from that, you can really get a look at what needs might be there, maybe even some hidden needs that you weren't aware of. And if after you've done that assessment, if you figure out that de-escalation is a needed role for your social worker to do, then I would really encourage you to take a look at these practice models and see which one might perhaps fit your library. And so I think one of the key issues, as any organization brings on a new role, right? A social worker is a new role, usually in a library. We're trying to figure out, well, where do we have space for them? And so sometimes that decision on where they're positioned might simply be a result of what space can we work to get the social worker in there, to have a space for that person. However, I would advocate that that isn't the best way to make this decision, that we really need to consider where you want them positioned and how you want them accessed. So, hiding them up on a floor where nobody's at probably isn't a great idea, or tucking them way in the back might not be the best idea. Just really think about where you can place them so that everybody knows how to access them. And so this access process needs to be very intentional and very clear. So every staff member needs to know how to access the social worker, and every security guard needs to know how to access the social worker. Patrons need to know how they can access the social worker, and there needs to be a clear process. A free-for-all probably isn't a good idea. I really liked how the outreach and summon model used the PICS as kind of that clearinghouse. That was really nice. But also the social worker had agency because she could just walk around throughout the library, do her own little mini assessments, see who might need help, and help people right on the spot. Now, one thing I do want to add about that, sometimes in the literature, you see concerns about, I believe it was in Dr. Geisler's work where he talked about some of the librarians were concerned about privacy, of a social worker meeting with patrons, like somewhere in the middle of the library. But what was so interesting in the two libraries where the social workers were summoned, and also were doing the one library that was doing outreach, not one person expressed any concern about that. And I often heard things where like, well, the social worker would kind of tuck away in a corner, yes, it might be in the lobby, but they would pull over into a corner so they could have a more, a little bit more of a private conversation. So there are ways to work around those privacy issues so that the social worker does have that agency to do that outreach in the library if that's what is needed in your library. And then I also really want to emphasize this interprofessional collaboration. I think as we've seen the popularity of library social work grow, sometimes the social worker gets plopped into a library and kind of with the mission of fix it. And there's not really an integration and an understanding, at least not at first, between all the roles, and not just librarians and not just checkout staff, but everyone, and especially the security team, whatever that looks like. In that library, they need to know and have a very good working relationship with the social worker. You don't want any animosity between those two teams. You really want them to be working in companionship with each other. In fact, at case 3, and I think also at case 2, the social workers and the heads of the security team sometimes train together the the other roles in the library. So I thought that was a really unique partnership. So I think that needs to be a clear expectation of that we don't operate in silos, but all three roles understand their roles. We're all clear about each other's roles, and we know how to access each other. I think what was really an important distinction about the role differentiation was that at the point violence was involved, that was a pretty complete like line in the sand of where you left the social work role and you entered the realm of either security or possibly law enforcement. That was pretty clear across all the cases, but the social workers were often involved up until that point of violence and keeping it from getting there. And so that was really neat. You know, they were reducing the incidence of violence because they had those de-escalation skills. So that was a really important thing. The other thing that I think is so important is for libraries to find a social worker with the right skill set. And here's what I mean by that. At least here in the United States, it is not a requirement of social work programs, both at the bachelor's level and at the master's level. They are not required to teach de-escalation skills. And so there are a lot of social workers who have those skills, but they have usually gained them in on-the-job experience or continuing education opportunities. And so just because a person has even a master's degree doesn't mean they have de-escalation skills. And as shown in this study, the BSW actually had extreme de-escalation skills. So, you know, I don't think we always have to go to the MSW level, and that might provide a way for more people to have library social workers because you don't have to pay quite as much for a BSW perhaps. But those BSWs, some of them can be incredibly skilled in de-escalation. The other thing, there are lots of other skill sets that they need in terms of like meeting those felt needs. So they need to have a really good working understanding of your state and federal and local programs, how to access them, what are the criteria, you know, having relationships with people in those places. All of that really helped these social workers to be extremely effective at meeting felt needs. And by meeting felt needs, they were able to de-escalate people before it got out of control. So I know sometimes hiring a social worker might be a daunting task because it's a new profession coming into the library. So I encourage you to find social work professors in your area, or even, you know, some of us that are doing the research around the world now, and ask them to help you maybe write some interview questions, or even to sit in with the interview with you, or to help you screen some of those resumes to see if you can't find a really good fit for your social worker. So just a few limitations I want to bring up. This was limited to the United States and large urban central libraries. It was also limited to the full-time degreed social work model. And also there were no solo practitioners here. They were all in concepts of in a team. And these teams were also already well established and integrated in the library. So the results that we found here of this perceived impact of a reduced reliance on law enforcement might not be the same in another culture or in a suburban setting, or perhaps with only one social worker. You know, those factors remain to be studied. And there are many more models out there, you know, just through word of mouth and through a lot of the speaking that many of the library social workers have done, and some of the writing that the social workers have done themselves. I know there are other models out there to be explored and to be researched. So by no means am I saying, you know, these are the only three. You know, there are many more. So now I'll open it up for questions. And let me stop sharing my screen here so that I can see you.
Hey, thanks so much, Mary. Yeah, so we don't have any questions in the Q&A yet. Feel free to pop them in there, and I don't think attendees have microphone rights now, so or you can pop them into the chat as well. But yeah, thanks so much for sharing your work, Mary. It's when we hear about that in the Australian context, things I wouldn't say we have less violence than, no, we have less violence than in the American context. I mean, happily for us, sadly for libraries in America, but yeah, it's interesting to hear how the role can be so different in different places.
Yeah, I think what really shocked me was, I've been a social worker for many years, and I've even been an outreach social worker. And I've been in situations where I've put myself in situations where I expected that it could be dangerous. And some of the librarians had been through situations that were more dangerous than anything I had ever experienced. And yet these folks the participants were just amazing. Every interview was a gift. There were so many just caring, kind, librarians and library staff and security team members out there. I was just so impressed. It just, yeah, it's great.
Hi, Mary. I've got a question. That all these stories of violence and that might scare social work students or social workers away from and cause any kind of reluctance. So how would you like to explain about the positivity of working in the libraries and still having some safety tips handy, like we do have for other fields of practice, for example, in child protection that we are more familiar with, but perhaps we're not familiar with the safety and other protocols for social workers?
Yeah. Well, certainly, it's not for the faint of heart. But I want to say, we have a whole field of librarians and security guards and checkout staff that are doing this that weren't, they didn't necessarily sign up for this. As social workers, most of us are trained that at some point we may encounter danger. And so we talk about that in our training. But in terms of the positivity, oh my goodness, I think there's so many positive things about library social work. For me, it's really just grassroots. These social workers around the world now are doing grassroots work from the ground up in their communities. And I think anybody who loves to do any kind of creative work or program development, I mean, that is most social workers who walk into the library are the first social worker to do so. So if you are one of those people, you will have great opportunities for creativity and collaboration and really making something. Whereas, in most other social work situations, you don't get that opportunity. So I think it's a wonderful opportunity. And I think also it's a great place just to meet people where they're at. So many people want to reach people experiencing homelessness, but they might have a hard time finding them, but when you are able in a library, they naturally come to libraries because it's a warm, safe space to be at. And so if your heart is for people that are experiencing homelessness or, in really desperate situations, then you don't have to go any further than your local library.
Thank you, Mary. We've got a question from Barb, and she's saying, "Hi, Mary, great job. I love your models. I'm interested in the training on de-escalation. Did the workers and security folks train together, or who trained them?"
Yes, sometimes they would train together. I don't have in my memory, Barb, the details on the trainings they did, but I can get that for you if you're interested, because I do have that in my dissertation. And thanks for coming, Barb. Barb's one of my old professors.
Thank you for coming, Barb. Lovely to have you here. Okay, it looks like we don't have any more questions, but if you do have questions, please email myself or Casey directly. I'm just posting our email address in the chat box.
Yeah, and as well, I'll put the link to where the recordings are going to be.
Yes.
Sabine in there. And yeah, Barb makes a good point that she can pull your dissertation, Mary, and if there's any librarians here, we know very well how to do that kind of stuff. But yeah, just in the ProQuest dissertation database, I'm sure your dissertation would be in that. Is that right?
It is. I do have it under embargo right now because I'm publishing out of that right now. So, but yeah, Barb, I can send that to you if you want it.
Thank you everyone for coming along at Charles University in Australia. And if there are any Australian attendees here, we do offer social work student placement in public libraries. So if you are interested, please get in touch with us, and we'll customize a placement plan according to the needs of your patrons, according to the needs of your community and your local library. Thank you so much for coming. Thank you, Mary, for your time.
Thank you for having me.
Thanks, Mary. Yeah, and we have in 2 weeks, we have Patrick Lloyd coming to us also from the US and the University of Texas in Austin to talk about his work as well in this area. Yeah, thanks, Mary. Thanks,
Thank
Sabine.
you.
Thanks, everybody, for coming.
See, I'd like to see the chat here before we close out.